Hello and welcome. In this lecture, we're going to be moving on to talk a little bit about climate change adaptation. So what are we talking about here? Well, we're thinking about the fact that climate change is going to have impacts, and we need to think about what we can do, particularly from a health perspective, to try and minimize those impacts. So again, when we look at the structure for response to the climate change issues, we have greenhouse gases increasing in concentration, leading to climate change, which results in a wide range of different impacts, ecosystem health and otherwise. And then we have to figure out what our response is, right? So one response is mitigation, and that mitigation is primarily focused on decreasing those climate drivers, specifically greenhouse gases. Whereas adaptation is, again, going back and trying to say, what are we going to do about these impacts of climate change? So we know that climate change is already happening. We're already experiencing the impacts of climate change. And we can anticipate that that is going to continue on into mid-century at best, in best case scenarios, temperatures are going to continue to increase. So given that, we need to think carefully about what we're actually going to do with these increases in temperature and other types of environmental impacts that we need to respond to. So by carefully planning and by instituting a range of different changes across healthcare systems and a range of different systems, we can actually decrease our vulnerability to these climate impacts and also create systems that increase our ability to be resilient when these different types of natural occurrences happen. So that's what we're thinking about here with adaptation. Again, focusing in on those impacts. All right. So when we think about this overall health impact framework that we've seen for the CDC and the wide range of different health impacts that we can expect, and these are just a sample of some of them, with adaptation, we're less focused in on those central components, which are the drivers of climate change, and more focused in on what we can do to deal with extreme heat or deal with poor water quality or deal with the types of diseases that might start spreading, right? So that's our focus there. Now, I talk about adaptation and mitigation fairly separately, and often they can be discussed independently, but it's worth noting here that they are not entirely independent, that the two do overlap, and very often things which impact adaptation can also impact mitigation, and things that impact mitigation can impact adaptation. So let me just give you an example here. So imagine that you're creating a city park, right? So if you're viewing that from an adaptation lens, you could say, I'm putting in trees to decrease the risk of that river overflowing and flooding the area and soil erosion, and also to decrease urban heat islands, which trees can do, and to decrease some mental health impact by creating nice natural spaces, right? So that'd be an adaptation lens. Or you could say from mitigation lens, we're planting trees to create carbon sinks, right? Now, so you could come at this from different perspectives or both. And by doing one, you could actually have an impact on the other. Now, in another example, you could think about transportation. So you could try and encourage people to move from using cars to using bikes or walking. And that would be a mitigation effort if you're thinking about it in the sense that you're trying to reduce emissions from cars, for example. Or you could think about it as an adaptation effort in the sense that you're decreasing the heat that's produced by cars that can impact urban environments, right? So the point here is just that these two factors do interact to some extent. Very often, different types of efforts will be in one vein or the other, and sort of described in that way. But it's important to know that they can contribute to one another. All right. So let's just step back and think a little bit about how climate change influences health and these health outcomes, right? So you could think of this in sort of a simple way. I'm going to show you a simple way of doing this, and I'm going to show the IPCC's more complex way of thinking about this. So when we're thinking about this, we can talk about the climate driver, and that's the increase in temperature or the things that are the direct impact from carbon emissions that is driving these issues, right? And that's a climate change component to this. Then we could think about the environmental condition, the weather condition, or something else that is coming out of this climate driver, right? And that's where we're starting to see the impetus or the exposure to this risk. All right. And then in the second step of the exposure pathway, we have the environmental hazard. And these are the things that actually directly will lead to the negative health effect. And then ultimately that will result in a health impact. So you could view this just, for example, with flooding. So you could have a climate driver, which increased moisture leads to increased precipitation, which results in flooding, which could result in contaminated water from that flooding being exposed to, say, sewers or other things like that, which could lead to waterborne illness, right? So this is a sort of way of looking at the chain of events that can occur in climate impacts. Now, it's important to note that one type of condition, environmental condition, can actually lead to multiple hazards and multiple health impacts, right? So you could have flooding, which could also, it results not just in increased runoff that leads to water-related infections, or contaminated water that leads to water-related infections, but you can also have high water that leads to drowning or injuries or other sort, etc. So the point here is that you can have many different types of impacts from those different environmental conditions. Now, if you think about this in complex ways, you think about all the different impacts that climate can have, you start having these fairly complex pathways for thinking about the ways in which we can see climate drivers ultimately leading to different types of health outcomes. Now, I think that another way to view this, which I think is a little bit more sophisticated and complex, is the IPC model for health impacts. Now, here we're looking at climate change impacts. It's described a little bit differently, but climate change, thinking about the heats, the floods, the other things that come out of this, leading to different types of environmental conditions that will be mediating factors. Environmental conditions, social infrastructure, and public health adaptation efforts that can essentially be mediating factors that determine how bad the health impacts will be that we experience, right? So in the environmental conditions, you can imagine that you could have different types of climate change impacts that will affect soil and air quality and other things in a range of different ways, depending on the conditions we're dealing with. We could also imagine that the social infrastructure will make a difference. So it could be direct exposure on society, on, say, heat stress or other things that cause changes in social interactions. Or we could think about indirect impacts. So it's not directly impacting people, but it's causing you have an increase in allergens due to increase in heat, which then leads to a health impact to allergies as a result of those allergens. Or you could think about social economic disruption, right? So you could have mental stress, which would from these environmental disruptions that lead to, say, mental health challenges. So this social infrastructure element of things is really important. There's many ways in which a climate impact, if you have something like flooding or some other hurricane, you can directly impact, say, healthcare systems or economic systems to such an extent that results in a wide range of health impacts, even beyond the flooding itself or the hurricane itself, right? So that's really powerful. And then when we think about other mediating factors, we would also consider public health systems and capabilities in terms of adaptation. The ways in which, for example, ways that we can adjust socioeconomic systems so that people who are much more vulnerable due to their socioeconomic status, can be more resilient in the face of natural disasters, or, for example, have early warning systems that help people prepare before a hurricane is coming, etc. So the idea here is that these climate change impacts are going to be mediated by a number of different factors to determine how bad those health impacts will be. Now, again, when we're thinking about adaptation, we're thinking about a wide range of different things. If you look at the different types of examples of health impacts around there, you think about conflict, like what can we do in terms of adaptation to decrease the risk of conflict, and that might involve, say, political structures being built. You could think about heat-related illness. So what would one do? Well, maybe ensuring that the elderly have access to air conditioners, for example. That might be some adaptation type effort. Or if you're thinking about respiratory allergies, how do you ensure that people know that allergens are present so that they can stay in spaces that are less likely to be exposed to those allergens? So you think about the wide range of different things that we can do given these known risks to decrease those risks. There's actually a lot of potential there. So the IPCC has thought about this a fair bit, and I'm going to show you a model that they have just to think about the possibilities for adaptation when we think about the impact of climate change. Now, the first thing to understand about this, so first I should just note, this is a sort of conceptual model for the impact of adaptation. It is based upon research, but it's also based upon sort of expert judgment of the people who wrote this IPCC report, right? So this is just estimates. The way this actually pans out will depend to a large extent. But their basic idea here is they're going to show images where in the gold color is a level of risk that we would have regardless of what we do in terms of adaptation. So there's a certain level of risk that there's not much we can do to change that risk. So we have physiological limits. So for heat stress, for example, there is actually a heat level that people really just can't survive at. There's not much we can do in terms of adaptation. We can do a lot in terms of adaptation to protect people, but at some point, people will be dying as a result of really high extreme heats, right? So there's some limits to what we can do in terms of adaptation. But what's notable in that orange grid is that this is showing what level of risk we'd expect with our current levels of adaptation versus if we actually made a lot of efforts to build adaptive structures and responses, right? So you could see at the higher level with current levels, and then at the other end of the orange block is with high levels of adaptation. All right, and essentially the difference between our potential by encouraging adaptive efforts. So they essentially made their estimates based upon different time frames. So they're looking at the present. So here at the current time, what they're showing is that in terms of impacts, we actually have a lot of capacity to deal with the impacts that we're currently seeing from climate change through adaptive efforts. So most of this is orange here. So these are places where there's a huge amount of potential. If you think about going to 2030, 2040, assuming that we have about a 1.5 degree Celsius increase in temperature, we're starting to see that central area being yellow in the sense that there is limits to what we can do for adaptation, but we can see still there's a large potential there for adaptation to decrease the health impacts that we're seeing, okay? Now, as you go out to 2080 to the end of the century, we're seeing much more substantial health impacts potentially, and this is assuming a 4 degrees Celsius increase in temperature. Now, you're seeing for some of these, there's much less capacity for adaptation to make a difference. And one of the main points to this is really highlighting the importance of mitigation to make sure that adaptation doesn't have to try and compensate for these things where there's real limits to what we can do in those situations, right? So at the same time, you see that when we look at the majority of this risk, we can cut a lot of this risk substantially by putting systems in place that are adaptive. Now, I also want to show an IPCC schema, which sort of gives us an idea of how adaptation can influence that risk. So here we're seeing different sort of dynamics by which you can have change. So we're looking at the overall risk, and we're seeing that overall 3-part component. Some of that risk is due to hazard, some of it's due to vulnerability to risk, and some of it's due to just exposure to those risks, right? So if we're thinking about reducing hazards, and we see those arrows going in, that for example, we might want to reduce hazards by putting in reservoirs to ensure that when we have droughts, we're able to deal with those hazards. All right. When we're thinking about vulnerability, we could think about different populations that are more at risk for climate-related impacts and try and put in social protections in place so that people can handle that risk more effectively. Or if you're thinking about exposure, we could think about how can we have good, high-quality early warning systems so that when a hurricane comes through, that people they're out of the harm's way before that occurs. So we can decrease exposure in that way. All right. So again, there's multiple ways in which we can try and think about this idea of adaptation. Now, again, as was pointing out in the previous slides, there are limits to adaptation. There's an extent to which sometimes there will be risk regardless based upon these changes in climate and these increased risks due to natural disasters and other types of situations. So we will still have to think about that and expect that. And that also, again, is motivation for the mitigation side of this. Now, as we go forward in the course, there's going to be a heavy emphasis on adaptation. And the reason for this is adaptation is, I think, particularly relevant to health professionals. If we think about the different things that we can do to deal with the inevitable climate change impacts that we're already seeing, and the increase in risk due to the way we anticipate climate to change in the future, we really need people who have real strong expertise in healthcare. And that ranges around a lot of different types of skills that you as healthcare professionals can provide to help out with this, and that other professionals cannot effectively contribute here. So whereas for mitigation, climate healthcare professionals have a lot to offer, it's my feeling that unless healthcare professionals are involved in those adaptation efforts, we're going to have a lot of trouble creating good systems. So when it comes to emergency response systems, figuring out how we address healthcare conditions where healthcare providers have to and experts have to provide information about how to deal with, say, infectious diseases, et cetera, and who are experts in the provision of direct care to people who are experiencing these harms. These are skills that are crucial to creating systems that are responsive to new climate stressors, right? Healthcare practitioners are really skilled in health communication. They do it all the time, and they have a lot of knowledge about how to do that as effectively as possible. And it's crucial to have them in those roles in terms of dealing with these health impacts. When we're thinking about health systems and how to create systems that encourage prevention, so prevention before health impacts occur, this is the domain of healthcare professionals and public health professionals, right? We can really contribute to thinking through these things and figuring out where our gaps might be and where our vulnerabilities might be so that we can put things into place before they occur. And that contributes to a lot of the skills that we have in terms of program planning and evaluation and creating high quality systems that can deal with these concerns. So, and the list goes on in terms of the things that healthcare practitioners can provide to this side of climate change response. So I want to emphasize here that adaptation is a really important thing for us to be thinking about. Again, we're in early stages of really thinking about adaptation as a field. It's, a field that is 30, 40 years old. So we're still learning what adaptive measures we might have, which ones are more effective and which ones are less effective. And there's a lot of opportunity for healthcare professionals to be leaders in that effort. So this is just a quick introduction to climate change adaptation. This is going to be a major focus as we move forward, and we'll talk about some of the different strategies that we can use in more concrete ways. But this is some general overarching frameworks for thinking about what we're trying to do here. All right, so there we go. I hope that's helpful for giving us some frameworks, and thank you for listening, and take care, everyone.